You might have heard the phrase cancer before, maybe from your friends, maybe from school, maybe from a doctor or something. Well, if you really want to know what cancer is, here's a video to watch. What is cancer? Cancer is a group of over 100 diseases caused by uncontrolled cell growth. There are over 3 trillion cells in the body of different types. They work, they die, and they get replaced. This replacement is called cell division. This process usually happens in a very controlled way, so that we maintain the right number of each type of cell. This is because of the DNA code of instructions, which carefully controls what each cell does, telling them when to die or when to divide. However, errors can appear in the DNA instructions, called mutations. DNA mutations can occur randomly when the cells don't copy themselves correctly. And these random errors build up over time, which is why cancer risks increase with age. DNA mutations are also caused by environmental factors that damage DNA, such as tobacco, smoke, alcohol, obesity, pollution, certain infections, and sun exposure. More rarely, mutations are inherited or run in families. Mutations are often harmless, but sometimes cause a cell to copy and grow uncontrollably, which is how cancer starts. These abnormal cells keep creating copies of themselves, growing into a clump or mass of cells, called a tumor. Some tumors stay in one place and do not spread, known as benign or non-cancerous tumors, and these are less likely to cause problems. Tumors can also be malignant or cancerous, which means they can spread to other parts of the body. Malignant tumors are more likely to cause problems as they invade other body structures, affect the way the body works, or use up the body's nutrients. Tumors have spread away from the primary state of the cancer called metastases or METs. Therefore, it is really important to detect cancer at an early stage, as it's easier to treat before it has a chance to spread. Routine screening tests are used to pick up some common cancers. It is also important to see a doctor if you are experiencing unexplained symptoms that could be a warning sign of cancer. Various investigations are used to diagnose cancer. These might include blood tests, imaging tests, and a biopsy, where cells are taken from examination under a microscope. If a tumor is found, these investigations help determine the type, size, and spread of the cancer, which is called this stage. This is used to work out the most appropriate treatment. The main types of cancer treatments include surgery, where the tumor is removed from the body, chemotherapy, where anti-cancer medicines is taken to kill off cancer cells, radiotherapy, where radiation is targeted to destroy cancer cells. Other forms of cancer therapy include immunotherapy, hormone therapy, and gene therapy. Some cancer treatments also have an effect on normal body cells, particularly fast-growing cells like the skin, hair, gut, and bone marrow. This can lead to a range of side effects such as rashes, hair loss, nausea, and tiredness. Cancer treatment might significantly reduce the tumor size and ease symptoms, known as remission. And if some remain in the body, the cancer might return months or years later, which is called a recurrence. The overall prognosis varies a lot of person to person, depending on the site, type, and stage of the cancer and treatment available. Due to the remarkable progress of medical science, advances in the cancer therapy are happening all the time.